So in today's webinar, we have an overall objective, again, in these webinars to create this virtual mechanism for peer-to-peer sharing outside of the Learning Collaborative stuff and the Focus 32P stuff that is done at the grantee meetings. And we're hoping that this enhances your overall improvement efforts. So this morning, again, we're going to do a roll call in just a moment. Please hold off on chiming in until your advisor calls the name of your team. Then we're going to go into kind of a recentering and refreshing on what is a community of learning webinar. We have lots of new staff that come on Teams all the time, and we're just going to take a pause and rewind for a bit and just have a short little thing on what exactly are these community of learning webinars. We're going to have a spotlight with our COIN team. So there is a national QI effort happening with MHVI. And the teams in Michigan are going to share a little bit about how that is going for them and what they've been working on. We're going to have our QI Advisors Corner talking about strategies for success, especially as we are moving into the final quarter of the fiscal year. If you need to do a short cycle, Angie's got some tips for you. And then we'll have reminders and final questions. So we're going to start with the QI roll call. So I'm going to start with the teams that I advise, first with the 32P sub 4s. St. Clair PAT, I think I saw Becky chime in. Are you here?
Yes, I'm here. Thank you.
Good morning, Becky. Washtenaw SOS PAT, Raina or Cheryl, are you on this morning?
Yes, we're here.
Good morning. Kent Bright Beginnings PAT, Julie and Karen, are you on?
Karen is here. Good morning.
Good morning. And then for my HFA teams, Wayne HFA.
We're here.
Good morning. Kalamazoo HFA, Denise. Muskegon HFA. I think I saw your camera pop up.
Yep, we're here.
Good morning. And Kent HFA.
I'm with Muskegon. Yeah, I'm with Muskegon, and Monica and Amy are joined in from their offices because we are spread out today.
Okay, good morning. Thanks for joining. Healthy Families Upper Peninsula, Kim and Carrie and team. Okay, Healthy Families Northern Michigan, Ashley and Trisha.
Ashley and Vanessa are here.
Okay, good morning. And then Saginaw HFA, Heather and the team. I see Julie Banks, Saginaw HFA, chimed into the chat box. Okay, so I will pass it off to Angela.
Hi everyone, this is Angela Precht. I provide QI advising for all of our NFP teams, so I'm going to see who from our NFP models have joined us today. Let's start out with Berrien NFP. Jackie and company, are you there?
Yes, can you hear us?
We can. Welcome, team.
Thank you.
Calhoun NFP. Thanks for joining, guys. Calhoun NFP, Michelle and team, are you here? Okie doke, we'll circle back. Celeste, is Ingham with us?
Oh, hey, we're here.
Hey, welcome, Ingham. We're glad that you're with us. Trina, are you and your team here from Hurley? Yep. Let's check in with our Kalamazoo team.
I'm here.
Are you here? Hey,
Julie.
welcome, Julie. Glad that you're here. Thank you for joining. Emily, are you and your team here from Kent?
Good morning. Yes, we are.
So glad you've joined. Thank you. Do we have our Saginaw NFP team with us?
Go ahead.
Hello.
Hi there. Oops. Getting a little feedback. And there it goes. Welcome, team. We're glad you're with us. Oakland NFP, have you joined yet?
Yes, we're finally here.
Hooray! We're so glad that you can hear us and we can hear you.
Great. Good.
I'll check and see. I don't believe that this team has joined us, but our newest NFP team is our Detroit team from Starfish. Has anyone joined from Starfish? Wonderful. Well, thank you, NFP teams. We're glad that you're here with us, and I'll pass on to Robin.
Good morning, everyone. This is Robin Vandermoor with MHVI, and I get the pleasure of coaching and advising the MDHHS, EHS, and PAT teams, and I get to work with the MD32P4 quality planning teams as well. So I'm going to check in and see who's on the line with those teams. I'll start with EHS PAT from MDHHS. So do I have anybody on from Ingham EHS? I know Kelly was planning to join, but she might have been a little late. All right, not yet. How about anybody on from Genesee EHS? Kim and team?
Yes, we're here.
Welcome. Good morning.
Good
How
morning.
about Oakland EHS? Tina and team? Do I have anybody on from Saginaw Early Head Start?
We're here.
Good morning. And how about Genesee Parents as Teachers? All right. Do I have anybody on from Delta Schoolcraft PAT? How about Eastern Upper Peninsula PAT?
Hi everyone, we're on. This is Kara.
Good morning, Kara and team. And how about Wexford Masaki PAT? Julie and team? All right. And I wanted to take a moment too and see if we have any of our partners on from MDHHS. I see Wendy. I'm not sure Annie might be on. I don't know if Tiffany's on today. Just wanted to check in and see if anybody wanted to say hi from that team. Oh, Wendy just said good morning through the chat. Thanks, Wendy. All right, and is Rita on today?
Sorry, wrong one. Rita's here. I didn't get my mic unmuted. Good morning, everyone.
No worries. Wanted to give you the opportunity to say hi. Good morning, Rita. All righty. I am going to pass things back to Lauren.
Good morning, everyone. I have the pleasure of working with a portion of the MDE 32P4 LIA team. So I just have a couple to run through. Susan, are you on from Calhoun PAT?
Good morning, Lauren. This is Jackie and Sue from Calhoun PAT.
Oh, awesome. Hi, Jackie. Hi, Sue. Thanks for joining. Anyone on this morning from Kent EHS?
Yes, good morning. Kim Evers is here.
Good morning, Kim. How about Kent Baby Scholars, Takia and team? Okay. And how about Oakland PAT? Terry, anyone on from your team? Okay, we'll loop back with that. And last but certainly not least, Saginaw PAT.
Just trying to.
Hello.
Hi there.
Hi.
so much for joining.
You're
All
welcome.
right, so that is all of my teams. I am going to turn it over to Grace now.
Good morning, everyone. So I coach 2 of our MDE 32P teams in the Family Retention and Engagement Collaborative. So Van Buren, PAT, are you guys on the line today? All right, what about Washtenaw EHS? All right, well, I am not sure who wants to introduce Brittany's team.
Jeanette.
Yeah, can we pass things over to Jeanette?
Sure. Good morning, everyone. My name is Jeanette, and I'm also helping to support Brittany's teams while she is out on maternity leave. So let's start off with Bay Aranac. Is anyone on?
Good morning. Yes, we're here.
Good morning, Rich. What about Livingston HFA?
This is Mary Ann Lalonde, sitting in for Maureen Wright.
Welcome, Mary Ann. What about Ottawa PAT?
Good morning. This is Maureen Schmidt with Ottawa.
Hi, Maureen. And then for Brittany's teams, I have, what about Muskegon EHS? All right, or Ingham PAT?
We're here. This is Michelle and T from Ingham.
Great, thanks so much for joining. All right, those are all of mine and Brittany's teams.
Were there any teams who have joined during that roll call who didn't hear your name called who want to chime in at this point? Not, we're going to get started. Okay, so I'm going to hand it over to Grace at this time to walk us through a refresh on what is a community of learning.
Thank you, Brenda. Yeah, so we thought it would be a good idea to just briefly touch on what is a community of learning for anyone who might be somewhat new to this like I am, or for anyone who might need a refresher. It's just always good to remind ourselves of why we all joined the call this morning and then to just guide the rest of our conversation today. So there are a few main components that make a community of learning unique from other types of conversations and learning environments. So the first piece of this puzzle is that a group of people come together who share a common interest. A COL can be in person or virtual, but no matter what the platform is, it creates this mechanism for peer-to-peer sharing and learning. So all participants are both educators and learners, and here is where ideas are shared in a safe space. So as new perspectives and ideas are shared, this new knowledge is intentionally created together. And that way everyone can benefit from the conversations and ideas being shared. So now that we've just kind of covered what in general is a community of learning, it's important to remember what our goal is, and that's to enhance the Michigan Home Visiting Initiative improvement efforts. So in order for a COL to be successful, there are some shared norms and agreements that all participants should keep in mind, and those are listed here on the slide. So learning from and with one another requires that all participants respect different perspectives and approaches that are shared. It also requires that we stay present and engage with the conversation and ask any questions when necessary to ensure that we understand what is being shared. And the most important agreement is that we all have fun. So now I want to hear from you. So I'm sure I left some things out of this definition of what a community of learning is, and I'd like to hear your ideas. So please speak up and share with the rest of the group. So first, what does participating in a community of learning mean to you? So you can either pop in the chat box or maybe unmute yourself and just shout out words, ideas, or anything that might describe what a community of learning means to you and what it means to participate in one.
And don't forget, if you want to chime in, you'll need to unmute your phone or your computer, however you join.
It looks like Jackie commented the ability to learn from others and gain new ideas and inspiration. Yes, love that. Thank you for sharing. What do others think? Getting ideas from others in similar projects. Yes, that's why we're here, to learn from each other and gain new knowledge. Awesome. Resource sharing with peers. Yes. So let's move on to our next question. So we'd like to know what you want to get out of this community of learning. So by the end of our conversation, what do you hope to have achieved? What's your end goal?
Well, I know I'd like to have some more ideas on how I can do to introduce or efficiently use CQI in our program to better inform my process.
Yes, great. Thank you so much. Like Saginaw EHS shared in the chat, new ideas for CQI projects. Ken mentions that they would like to hear more about how other programs are involving parents. Great ideas. All right, and I'll move us forward to our last question. What topics would you like to see shared in future community of learning calls? We want to make sure that they're meeting your needs and your wants. So what ideas do you have? Any ways that this can be improved upon? Any new topics that you'd like to see covered? Kent County NFP mentions, I would like to hear more about, oh no, that was already said. Sorry about that. Got ahead of myself. I know that one's kind of a big question and it might take some time to reflect. So if new ideas come up and you have some ideas on what we can cover in future calls, feel free to reach out to us. You know where to contact us. We'd love to hear your thoughts. So thank you everyone for just taking a few minutes to share your ideas and kind of recenter on what this means, this community of learning call. And from here, I think I'll hand things over to Robin. Oh, sorry, it looks like I'm missing some. So Kent says maybe some different tools that are less commonly used in the CQI process. All right. It's a great idea. It looks like Jackie from Calhoun mentions a focus on innovation, new ideas, and processes. Thank you so much for the ideas. Those are great.
Well, thank you so much, Grace, for kicking us off there with our COL conversations. And I think it's really exciting today because we get to talk about an initiative that some of you are participating in that's national that I think some on the line know about, and maybe perhaps for some of you this is new. So hopefully you'll learn a bit in this next little section that we have. But Michigan is participating in the Home Visiting Quality Improvement and Innovation Network 2.0. This is a national initiative. We actually were privileged to participate in the HV Coin 1.0. So this is the second 5-year iteration of this initiative. And really this initiative was established to work toward improvement and innovation in home visiting. And I'm going to dive in and kind of tell you a little bit about home visiting coin in general, and then get into the 2 specific topic areas that we have Michigan teams working within this year. So you're probably wondering, for those of you that are a little bit less familiar with the home visiting coin, what is a home visiting coin? Well, this is a national initiative using the Breakthrough Series model, so the model out of the Institute for Healthcare Improvement. This should look familiar to a lot of you because we use this here in Michigan for our Quality Improvement Learning Collaboratives. And they're using this model to really accelerate improvements in select process and outcome measures within specific topic areas that the home visiting coin has had focus of in the past during COIN 1.0 and is looking forward to focus in the future during COIN 2.0. And I'll get into the details of that in a little bit. It's also important to note that this initiative is really grown out of the Maternal Infant Early Childhood Home Visiting Program at the federal level, so MHVI, as many of you know it. This is part of the charge of that national initiative was to really work on improvement and innovation and within with states and LAAs that are participating through MHVI. So the teams involved in this initiative are teams from states that have elected to participate in the home visiting coin because LAAs were interested in working toward improvement in some of the topic areas. And I will get into the details of where Michigan kind of fits into this picture here in a few moments. So for COIN 2.0, the overall aim of COIN 2.0 is to achieve improvements with 25 state and territory MHVI awardees and 250 local implementing agencies over the course of a 4-year period. So COIN 2.0 is going to be composed of 3 different waves. The first wave started in the fall of 2018, and Michigan is participating in the first wave. It's anticipated that the second wave will begin in the fall of 2019. Applications for that are anticipated to come out in September. So wave 2 will be starting here shortly, and then wave 3 will begin in 2021. So it's kind of spread out over the 4-year period of time that they have to do this work. Michigan is participating in 2 aspects of COIN 2.0. The first is one of the charges of COIN 2.0 was to expand the topic areas for learning collaboratives that they were running. And for this first wave, they added a QI learning collaborative around intimate partner violence. And Michigan indicated interest in participating, and we had 3 local implementing agencies that wanted to participate in this particular topic area within the COIN. Those local implementing agencies that are participating are Oakland Nurse Family Partnership, Kent Healthy Families America, and Muskegon Healthy Families America. And you're going to hear a little bit more from them here in a little while. Additionally, the second charge of COIN 2.0 is to work toward scaling up and spreading improvements in some of the topic areas that were run during COIN 1.0. One of those topic areas is breastfeeding. And interestingly enough, for the breastfeeding collaborative, they achieved success in many of the measures that collaborative is working toward, but they didn't quite make the aim for that particular collaborative. So one of the interests was to do a little bit more 90-day testing around that breastfeeding change package that's associated with that topic area to see if, improvement in the way that they expected can really be achieved so that they can work to scale up this particular topic area in the coming years through waves 2 and 3 of home visiting COIN 2.0. So we have 2 teams in Michigan that were interested in participating in this 90-day testing period to further really work with that change package. And both of these teams participated with COIN 1.0 in this topic area as well. And those 2 teams are Calhoun Nurse Family Partnership and Hurley Nurse Family Partnership. And I'm hoping that you'll be able to maybe hear a little bit more from them and some of their experiences here in a bit. So let's take a closer look at the Intimate Partner Violence Collaborative first. So as I said, this is a new collaborative, and I want to share with you the states that are participating in this collaborative. So Michigan is one of the participants, the state of Massachusetts, the state of Minnesota, the state of Washington, the state of South Carolina, and the state of Oregon are all participating in this collaborative. So this collaborative is bringing together 6 states to test this particular change package, and there are multiple LAs within each state that are testing changes in this area. This is a little clip of the theory of change, or better known as the key driver diagram that lots of you are familiar with our Learning Collaborative work here in Michigan, to give you an idea of what these teams are really working on. So these teams started their work back in the winter. The first learning session was held in January 2019 to kick off this work. There was some pre-work that happened before that time. But this collaborative has 2 aims associated with it. So they're working toward these aims and hoping to achieve them by March of 2020. So the first is that 90% of participants with identified intimate partner violence are offered supports or services aligned with their self-identified needs and priorities. And the second aim is that 85% of participants with identified intimate partner violence who are offered supports or services receive follow-up from their home visitor. There are 7 primary drivers that are the COIN and the faculty that have been assembled for this believe are critical to really supporting LAs and working toward and achieving these aims with the families that they provide services to. The first is comprehensive data tracking system for intimate partner violence. The second is competent and supported workforce to address intimate partner violence. The third is successful integration of parent leaders and partners in continuous quality improvement efforts. The fourth is trauma-informed and healing-centered approach. The fifth is safe and respectful conversations on healthy relationships and screening for intimate partner violence. The sixth is comprehensive, fluid, individually tailored, and highly collaborative, safer planning and follow-up. And the seventh is comprehensive, ongoing, cross-sector, and effective collaboration with available nonprofit programs that's community-based and advocates for victims of domestic violence or sexual violence and other community partners to connect families with desired services. So really getting at that community-based approach. So a couple of things you'll see in here is that COIN teams are really actively working on engaging parent leaders in the work. And really working both on the data side of things, but as well as collaboratively with community partners to really robustly support families who are experiencing intimate partner violence and need this support to be sure that they have the processes in place to fully provide that support to families. So this gives you a glimpse of what those teams are really working within. So as I said, we have 3 teams in Michigan that are participating in the IPV COIN: Oakland Nurse Family Partnership, Kent Healthy Families America, and Muskegon Healthy Families America. And I'd like to give them each a little time to just share a couple of highlights from their experiences thus far. We are at, I would say, kind of about the halfway point. The second learning session was just completed in May, so that's pretty fresh and recent, and that's sort of the midpoint-ish of the collaborative. So Michelle and team from Oakland Nurse Family Partnership, can I call on you first to do a little bit of sharing of some of your experiences participating in the IPV collaborative?
Sure. Okay, we've been working, when we started working, we were focusing on increasing our education, educating ourselves on IPV, and we worked with our local domestic violence shelter. We had 2 intensive trainings with them, and then we had a roundtable discussion where we talked about resources and such with them. We are also in the process of testing different types of tools that we can use to work with the clients and learn how to talk about healthy relationships and see what we like about each one, what we're not liking about each one. And then we were bringing in the parents. We really wanted to focus on bringing in parent input, and we're really excited about that. So one of the things we started working with the parents is drafting a script that we could use, that we can go and introduce the programs, what the Intimate Partner Violence Collaborative was all about, and how parents, we would like to hear their voice. We want to hear what they have to say and how they can help make a difference in the community. So we worked on this script. We started working internally, the nurses on it, and then we went and we brought different parents in to view the script. We did it over the phone with one client who has since moved from our location, and we had a phone conference with her, and then we also brought it out into the home with certain parents and to get their input on the script, what they liked, what they didn't like, what they felt would help. And then the exciting thing is last Thursday, we actually held a parent focus group, and we brought in lunch. And the purpose of that focus group was twofold. One, it was to really talk about what CQI is and how having their voice really makes a difference. And so we covered that, and then we also wanted to hear their voice and opinions on some of the tools that we've been looking at to really see how they felt about it and what they learned. So it was pretty cool. We had one parent come with her son, who was just about 2 years of age, and we had, she brought her sister, who is a teenager, a senior in high school. Then we had another parent come who just turned 18, has a 6-month-old, and what was very interesting is her boyfriend, the father of the baby, joined in as well. So, of course, we weren't expecting that, but we heard from him, and it was very, very interesting. So we did get feedback on certain tools that we were using and finding out how they liked them, what they thought was good. And what we're gleaning from that conversation is that probably having a toolbox. All these things had benefits, and some of them had things that maybe wouldn't be as great to use with certain parents, but better to use with other parents. So we're looking at a toolkit. Like, all of them seem to have benefits, so let's put them all in this toolkit. And as we're working with families and we learn about their learning style and how they feel about things and the nurse's judgment, that would help guide us to know which tools might be most helpful with these families. So that was kind of exciting to do that. And then some of them are like quizzes that you take and you learn about, is the client in an abusive relationship? Well, what was really interesting with these 2 clients that were there was they actually found themselves to be the abuser at times. And they shared with us their thoughts on that. So that was something else that we were not expecting. So we're still working, with the parent. We were hoping more parents would have come, but the parents that we had there were fantastic. They gave great input. And so one of our next PDSAs is going to be we developed a PowerPoint, and we're going to take that PowerPoint on the road and use it in some of the homes. The nurses will be working with some of the parents in their homes, because we'd like to see how many are interested. And then if they are interested on being on our CQI team, in what ways can they be? Can they attend meetings? Would it be phone calls? Would it be surveys in the homes? So there's all different things that we're looking at. So we're really working hard on that. We're also looking at our moving on to safer planning for our clients, testing some safer planning methods, and then eventually getting to what are we going to be adopting in the agency and making some sort of, we call it Read Me First, where it's guidelines of what we use, and it's teaching tools to help teach staff in the future. So that's kind of where we're at right now.
Thank you so much, Michelle. You and your team have just done a phenomenal amount of work in a very short period of time, and have learned so much. And thanks so much for sharing all of the great steps forward and work and thought that you've been doing around involving parents. I think that especially hopefully kind of supports some of our earlier conversation today of folks wanting to hear a little bit more on how other programs are involving parents and what that's looked like to get some ideas of different ways of onboarding them and kind of really wrapping them into improvement efforts aside from, just doing surveys or asking quick questions and home visits. So thank you so much for sharing that. Really, really appreciate it. And congratulations to you on all of your success so far in participating in the Home Visiting Coin IPV Collaborative.
Thank you.
All right, I'm going to pass it over to Elise with Kent HFA. Elise, do you want to share some highlights of some of the things that you all have been engaged in with the IPV Collaborative?
Sure. So we also started with some training of staff. We chose to do that through the Futures Without Violence website. There's a bunch of webinars in there that worked really well for our team because Kent County is a large HFA program. We have 12 workers and 2 supervisors, and it involves 3 agencies. So being able to log on from our own locations to get that training was really, really useful for us. And the staff really liked it. And it actually led, doing the Healthy Moms, Happy Babies webinar training actually led for our team to our follow-up cycles because of things that were suggested in that webinar. One of them being waiting a bit to do the rat screening until families are a little bit better engaged. So one of the practices that, or one of the PDSA cycles that we tested that we've adopted is to start out with healthy relationships, education, and discussions with families as part of our engagement process. And then after that trust is built and we've gotten to know the family, then later we come back and do the actual rat screening in hopes that it would get us a little bit more honest responses, perhaps. And in all honesty, we haven't had any more positive rat screening since we've done that, but we do feel like we're getting better disclosures and identification from families since we've taken on that practice. So we still considered it a successful cycle. So then we moved on from there into building community partners with our IPV resources. We're very fortunate in Kent County that we have 2 domestic violence shelters, Safe Haven and the YWCA. So we did meet and greets with both of those agencies over the last 2-3 months. And that was very useful also. Both of those shelters invited us to their locations. Of course, we can't tour shelters because of confidentiality and HIPAA and all that, but we were able to see what their facility looks like when you walk in the door. What does that look like? What does the staff look like? This is how you can expect to be buzzed in, that kind of thing. And then to be able to sit down with our teams and be able to ask questions and to get feedback and talk about if our family is experiencing this, how would you handle that? Or can we refer, what services do you offer? And there's an array of services at both of those shelters that are slightly different from each other. So it was helpful for us to be able to get information and differentiate that. That in turn led to, specifically at the YWCA shelter, they offer a lot of training for their community partners, of which anyone who wants to be is considered a community partner. So it's us now, or one of them, where we can go to their site, but they do have some grants to do community-based trainings. And one of them is on what the IPV effort would call safer planning. They just call it safety planning. And they really talked a lot about how when safety planning around intimate partner violence or domestic violence, whichever terminology you're using, it's really important to have, it can be called a long-term and a short-term, or it could be called a proactive and a reactive safety plan. But when you're planning, when somebody's in a safe space and you're planning for how to stay that way, that can be a more in-depth kind of involved safety plan. But when you're talking about when a person is in immediate danger, what are their steps? It has to be very, very simple and concise. You can limit it to 1, maybe 2 steps. Like, I'm going to run to my neighbors, I'm going to call 911, because physiologically, when we are in panic or stress mode, our brains aren't capable of processing like a decision tree situation. And so it has to be very simple and concise and easy to follow through on. And so that was very useful information to come out of there. And they actually offered to come, like I said, to our site to do like a 90-minute kind of follow-up training. And so we believe that that's probably where we're headed next, is to move into the driver that's on safer planning. We also need to work to engage parents. It's something we've struggled with in our program in general. We're really good at getting feedback from parents through home visits and that kind of thing, but having them present at our CQI meetings and things like that has been a much bigger challenge. So I think those are the two areas where we think we're headed next.
Thank you so much, Elise and team. And again, congratulations to all of you on all of your efforts that you have been engaged in with the home visiting coin. You have done a lot in a very short amount of time. And while you were talking, Elise, there was a good question that came in through the chat from a team that's a little bit less familiar with the Futures Without Violence training, and I think we probably have some others on the phone that might be wondering the same thing. So I'm wondering if you could just take a moment and tell everybody a little bit about the Healthy Moms, Healthy Babies training that you all participated in through the Futures Without Violence, so that others that are maybe interested in that could take a look at those resources.
Sure. So the Futures Without Violence organization is a national organization aimed at preventing and assisting families experiencing domestic violence, or IPV. And they have a lot of great resources on their website. They have several webinars. One of them is the Healthy Moms, Happy Babies. If you Google Futures Without Violence and go to their website under resources, it lists some of those things. They also have a lot of materials, like they have safety cards. They have ones that are specific even for certain populations, like teenagers. And most of their materials are free to download or receive printed copies of. You just pay for shipping. So it's a very, very useful resource for any home visiting program to use and access.
Thank you so much, Elise. I hope that answers the question, but if it doesn't, please feel free to ask more about this as we kind of move into the question portion of this here in a few moments. Okay, and last but not least, Muskegon HFA, do you want to share some highlights from some of the coin work that you have been engaged in as a team?
Sure. This is Heather Wolf, and so currently we are focusing on training at the moment and kind of building our competencies in working with families with IPV. Our staff recently participated in a training that was focused on reproductive coercion and some of the intricacies involved in that. And we also participated in a webinar, again, off of the Futures Without Violence website on the impact of domestic violence on children. So those have been very useful to us thus far. Prior to that, I think one of our bigger wins was kind of reestablishing our connection with our local domestic violence shelter and advocacy center in Muskegon. Our agency has previously had a good relationship with them, but it was nice to invite them over, and they did a training for us and just talked about the referral process, what to expect, all that good stuff, things that we can talk with our clients about to sort of ease some apprehensions. We are working, it'll probably be sometime down the road, but working on like a little mini tour of the facility. While we can't tour the whole thing, we can at least get a feel for what clients might expect when they go. One of the other unique things that we weren't really anticipating coming out of our connection with our DV shelter is learning about a domestic and sexual assault task force in Muskegon County. And this task force has been going on for several years. However, we weren't ever aware of it. So through this COIN project, we've actually begun to participate in this domestic and sexual assault task force. And that's been very insightful, I will say, because we're learning we're learning our community's, the law enforcement response to DV victims and how they're handling that, like on the street, basically, as well as how the prosecutor's office in Muskegon County is filing charges, convicting perpetrators. So this is, it's very good information on the community level. So we're going to continue to participate in that, and hopefully we'll glean even, more information and insight. One of the other things that we were able to do is engage one of our parents in our HFA program to be a parent leader. And she was actually very excited to do that. She's got a significant IPV or DV past. And one of the ways that we've used her insight is in using one of the healthy, Elise had mentioned it earlier, the Healthy Moms, Healthy Babies safety cards. Our program has begun using those right around the time that we do our RAT. And it kind of lists in detail some different warning signs or things that a woman could be aware of. But anyways, the parent leader was able to give some insight on those safety cards for us, and it is a parent perspective on, well, maybe try stapling a business, one of your business cards on the back. That way it covers up the words domestic violence. So it might be another safety measure to protect her from the perpetrator. So she was able to offer some really actually practical, helpful insights for us as we implement the use of these cards. So yeah, so that's kind of where we're at.
Thanks so much, Heather, and congrats to you and team on all the efforts that you have been working on and have achieved through your experience with the home visiting coin so far. I think that across all the teams, I've heard about so many fantastic learnings that you've had, things that you've discovered that maybe you were a little bit surprised about and really glad to learn about and know a little more about. And have just learned so much, again, in such a short period of time. So congratulations. Now I'm going to take pause and really open it up to all of you to see what questions folks have for these IPV teams that have been participating in the home visiting coin. I know that this is actually a topic area of interest for many of you on the line. It came up in the evaluations that we did after the last grantee meeting as something that you want to talk more about, learn more about. So I don't even know if folks have some curiosity questions right now that might be good to toss out for the good of the group. But what questions do you have for the LAA teams or for each other around intimate partner violence and some of the work that's going on in that area? Feel free to unmute yourself and ask your question through the line, or you can also send your questions in through the chat. We have a question that just came in from Ingham, PAT, and they're wondering, where did you get the surveys and the checklist? Did you create them, or were they something that you were able to get from some of the resources that you've been accessing?
This is Elise. I don't know which surveys and checklists exactly is meant. But the RAT screening tool is the validated tool that is, it's one of the validated tools that the state has approved for domestic violence screening in Michigan. But I don't know what else you mean. I'm sorry.
Michelle, do you have, if you want to chat in anything more specific that you might have questions about, the RAT tool, so the Relationship Assessment Tool, is something that you can access via the Futures Without Violence site, the link that Brenda just shared through the chat just a little while ago. So you can see that particular tool by accessing the site. And there are lots of other resources available on that site too, but if there's something specific you were wondering about, let us know and we'll circle back. Kent County Nurse Family Partnership had a note to Michelle and team over at Oakland. They're excited to see what tools you end up using to really talk about healthy relationships. And I think probably hopeful that maybe you might share some of those with the group as you continue your learning.
Absolutely, we will share. Did you want me to share now some of the resources?
If you have resources to share already that you're comfortable sharing based on the testing that you've done, Michelle, certainly you can feel free to send them our way and we can get them out to the group.
Oh, okay. Sounds good.
Thanks so much. Other questions, wondering, curiosities that you might have for some of these teams that are participating in the IPV coin? Kent County Nurse Family Partnerships wondering what's been the most beneficial about your experience with the coin thus far. If anybody or all are willing to take this question, feel free to chime in.
Okay, this is Michelle from Oakland. I'm going to be really honest. It's been very, very overwhelming. One of the things that I wasn't in the first one, so I don't know how that was. But for this one, the expectations of the PDSA cycles, like you got to just push them out, boom, 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 boom. And that's been very overwhelming. And at the same time, we are learning a lot, and that part is exciting to be involved because I do feel that we're going to, in the end, have some really good resources to share and to use, and they're going to really be beneficial with our clients. But the amount of work and expectations of these PDSA cycles, I was not expecting that.
This is Elise. Heather and I are actually in the same room together, and we would absolutely ditto that it is a lot of work and it can be overwhelming. Not only running so many PDSAs, but the data collection is a little bit more challenging than what we do for the state collaboratives, in our opinion. However, same thing. We're learning lots of resources. It is helpful to have access to resources and tools from, people even from other states that we might not otherwise have found. And it has forced us to do things that will wind up benefiting, I think, the program. So there's a cost benefit balance, hopefully.
And this is Michelle again from Oakland. I did want to mention one thing that I learned after we were doing our first PDSAs, or that we learned, I'm speaking for the group, is that at first we were like having everybody in the group testing whatever we were testing. And then working with our contact person at COIN, she, gave guidance of maybe having one nurse or two nurses doing this, like not having everyone doing it because A, what if it doesn't work? And we don't have to have everybody involved. But B, it allows different people to be doing different things. So that bit of information did help us, but it's, like I said, it's still overwhelming.
Thank you all for sharing those benefits and also being, really frank about the commitment that you've also made and some of the challenges that have come with that, but how you have worked to overcome some of those challenges and are really hoping that the good learnings that you have outweigh some of the really sort of weights on time that you have with all the different parts and moving pieces and the speed that the home visiting coin moves forward with. We did have one more question come in to the chat while you all were sharing. Wondering a little bit if you could speak a little bit more to, and I think that Michelle, this might be a good one for you all to take, but I would invite Kent and Muskegon to chime in as well. How are you getting willing parents to participate in your improvement efforts?
Okay, this is Michelle from Oakland. One of the ways I guess we started was, each of the nurse home visitors knew, their clients, and they were able to maybe recognize clients that they thought might really be interested in being involved. And so we started there. And we started working with them on the script. And then the nurses, we invited many more than just the two parents that came, but we started with parents that we really thought would want to be involved. Another thing that I didn't mention before that has been very interesting, and we actually thought of this, I'm going to actually give the credit to Sue Martinez because this was her idea. We do every Friday strolling with NFP, and we've sent invitations out to our clients, and we've asked them to meet at a local track in Pontiac, and we would go walking with them. So we'd be talking about exercise. Then we would be bringing blankets, and at the end we'd be all sitting around. They'd bring their kids. We'd play with bubbles. We would do some sort of educational project with them. It might have been on nutrition. One of the nurses, Mary Beth, one of our great chefs here, came up with this wonderful yogurt. Was it yogurt? Yogurt. Oatmeal in a jar, where we were able to share it with the parents, and that got them going. And then we also, in doing this walking, we're also able to bring up things with CQI. So I have to say, what our biggest thing that got us going with which parents and this and that was we really reached out to the ones we thought would be receptive.
Mm-hmm. Good.
Thanks so much, Michelle. So really kind of trying to find some of those early champions that you can bring on as parents that can then spread it to other parents so that you can increase your involvement over time. And some really great innovative strategies for talking about CQI too. Thank you so much for sharing those details. All righty. Well, if folks have any more questions about the IPV coin piece, please feel free to send them in through the chat. I'm going to move us into the breastfeeding collaborative, so we have a little time to hear from those teams before we move into the last couple of pieces of our time together today. So the breastfeeding collaborative, there are 3 states participating in this 90-day testing period for this particular collaborative. Remember, this collaborative is working towards still meeting the aims and some of the measures within that particular theory of change. So Michigan's participating along with Rhode Island and Florida. And to give you an idea of sort of where this collaborative has been and where it's hoping to go, during HV Coin 2.0 or 1.0, this collaborative had strong results in the following areas. Home visitors using data to inform practice or improve practice. Home visitors being trained in infant feeding and lactation, that improved from 54% to 100%. Breastfeeding initiation rates improved from 47 to 61%. Exclusive breastfeeding at 3 months improved from 10% to 13.5%. And exclusive breastfeeding at 6 months improved from 5% to 8%. So there were strong results in several of the measures and indicators that this collaborative was working toward achieving during Home Visiting Coin 1.0. However, as I said, there was still some room for improvement, which is why the coin is investing some time in testing this theory of change a bit further during Home Visiting Coin 2.0. So they have room for improvement still in the following areas. Women with a need for breastfeeding support really receiving that support. Home visitors' ability to identify who needs supports in a timely way. And rates of breastfeeding initiation, 3 and 6 month exclusive breastfeeding, those remain below the national average. So they're looking toward moving the needle a little bit further in all 3 of those areas as well. So this 90-day testing period, where teams are running cycles during this 90-day period, they're looking to achieve a couple of really specific things. So they want to know if during this period, will more women receive breastfeeding support they need if, 1, they build home visitor capacity to use the breastfeeding self-efficacy scale short form to identify high-risk clients, and 2, build local implementing agency capacity to develop strong community partnerships to offer timely breastfeeding support. So really, really focusing on those aspects of ensuring that women who need support are getting that support in a timely manner and getting that support robustly, accessing resources that exist within the community as well, because as we know, home visiting programs, you can only go so far with this part and piece, and you really do need the supports of others within your community that can work to support these women in a well-rounded way with their breastfeeding journey. So what the Home Visiting Coin did is based on the first iteration of this learning collaborative, they refined their theory of change. So they refined that key driver diagram to get at some of the learnings that were accomplished through Home Visiting Coin 1.0, so that teams who are participating in this 90-day testing period can use this refined theory of change and overall change package to work toward learning a little bit more, especially when it comes to ensuring that women are getting the support that they need for breastfeeding. So I know it's hard to see on here, but essentially what's happening is there is testing happening in those different intervention areas that are highlighted in yellow. And those really have clear connections and focus to those 2 questions that I just shared that this particular effort is hoping to answer within this 90-day testing period. So as I mentioned a little earlier, there are 2 teams from Michigan that are participating in this 90-day testing period, Calhoun Nurse Family Partnership and Hurley Nurse Family Partnership. And I want to give them both a little time to share some of their experiences. I did see that I believe Hurley was able to join the call. So perhaps maybe, Trina, could you kick us off and share any highlights from your work thus far? I know that you have just gotten started and are only a little ways into this 90-day period, but what kind of highlights would you like to share from your team experiences so far participating in this effort of the Home Visiting Coin?
Well,
Trina, we're getting a lot of background noise. It might be because...
okay, can you hear me now?
Yeah, yep.
Okay, wonderful. Okay, sorry about that. Some of the highlights that we have had is that we were able to allow our nurses to take the home visitor breast self-efficacy skill survey, just to kind of assess how comfortable or confident they felt in administering the questionnaire. And we found that the nurses were pretty confident. All of our nurses are CLC trained. So we were starting off, we had a pretty good start. What we did is we looked at all of the available resources that we had, and we had formatted them back in 2017 to kind of like standardize what we would use. And what we did is we refined it to see what we could add that was new resources in the community, or new facilitators that had been added through NFP, or other resources that we could use that were available through the Michigan Breastfeeding Network. And so we compiled that list, and what we did is we kind of rated the strength of our relationship with these particular programs, and we try to assess them based on their availability, their turnaround time for getting in contact with our clients, and we tried to see how could we standardize this so that when we are assessing our clients for their needs, we can then help them determine what's going to be the best community resource that we can link them into based on their needs, based on their interests and their wants, as far as the supports they would need for breastfeeding. We are still in the process of some of our moms turning 36 weeks, so we've only been able to administer the 36-week questionnaire to 2 of our moms, and they're in the process now of completing their feeding plan. And a part of that feeding plan is going to include how to contact these resources. And we are still in the process of working out who will be a key contact person if something were to go wrong, or maybe they delivered on a Saturday when we don't have our IBCLCs available in the hospital, what will be their alternatives. And so we're trying to make sure that we look at every possible area that we can provide coverage, so if something were to go wrong, they will be able to access the necessary supports.
Wonderful. Thanks so much, Trina, for sharing some of the highlights from your work so far, and congratulations to you and your team. You really literally are only like about a month into this, so a lot has been accomplished in a really short period of time. Thank you so much for sharing.
Well, thank you. Bye-bye.
And I'm not sure if anybody was able to join from the Calhoun Nurse Family Partnership team, but if you are on the line and want to share some highlights from your experience so far, we welcome that.
Oh, you still get feedback. I was trying to make it so you could hear. Maybe you think I should hang up this. And we listen to the
Trina, I'm not sure if you're able to press mute on your either phone or computer. We're still able to hear your team, and I think that might be what's creating some of the feedback. Thank you.
All right. It sounds like maybe we weren't able to get anybody from Calhoun Nurse Family Partnership to join today. So I'm going to move us forward and see if there are any questions at this point on this particular breastfeeding home visiting coin effort that Michigan's engaged in and has a couple of teams doing this for their 90-day testing. They could be questions or curiosities that you might have.
Trina, what's the response from the moms regarding the use of the breastfeeding questionnaire? Are they engaged in that? Are they interested in it?
Trina, you might have to unmute your line again. Trina, you can feel free to, if it's a little easier, to share through the chat box. I see too that we have a couple of other questions coming in as well, and Julie will be sure to circle back to yours as well. Ingham PAT is wondering how are hospitals and prenatal educators involved, especially with initiation. Trina and team, I don't know if you can kind of speak to that from your community's perspective and the families that you have been working with when it comes to breastfeeding. And then, Teresa, you're wondering if the breastfeeding self-efficacy scale short form is available to anyone and how to access it. So I think I'll just give Trina and team a few more moments to see if you're unable to mute. We tried to unmute you from our end, but we can't. So you might have to either, I don't know if you've joined via your computer and you can unmute by pressing that microphone button, or if you're on the phone, you might have to unmute on your phone, either using your mute button or pressing *6 to unmute. Oh, Trina just responded in the chat, and she says the mothers have been engaged and interested, so in that self-efficacy scale that they're using, and that it's really helped them identify areas where they're not quite sure about breastfeeding. Thanks so much, Trina. I'll invite you to, Trina and team, to respond if you have some thoughts on either of the other questions that have come in through the chat, hospital and prenatal educator involvement, kind of from your perspective in your community, and then the breastfeeding self-efficacy scale short form. We can also look into that a little bit more here at MPHI and see if we can send that out to all of you as well. And I will invite anybody, if you have any further questions about the home visiting coin, to feel free to send them in through the chat, or you can always email us or email other teams, the teams that are involved in the coin, to find out a little bit more. Hopefully this was helpful to hear a bit about an effort that some of you may have been familiar with, some of you may have not, and Michigan's involvement and what teams are learning so far. So without further ado, I am going to pass things over to Angela, who is going to take us into our MPHI QI Advisors Corner for the day.
Thank you, Robin. So today for our MPHI QI Advisors Corner, I have created a few slides that I'd like to walk you all through and to really share as we start to get into that very last quarter of the fiscal year. I'm sure some of you are also feeling that finish line of fiscal year 19 kind of showing up on our horizon here. And at this point, your teams may be thinking about, wow, how am I going to complete my PDSA cycles for this fiscal year? Whether you've started and completed any or both of your particular funding requirements for PDSA cycles, I'd like to just walk through a few considerations for your teams, both this fiscal year and when you're getting ready to start next fiscal year. Some simple ways to get the momentum going. I heard someone mention earlier today that they were looking for ways to infuse CQI in effective or efficient ways, and I'm hoping that some of the takeaways from this are breaking down our PDSA cycles, especially in that plan stage, into three simple ways to think about it. So I want to remind you that most of you have been through our trainings. You know the stages and the steps of the PDSA cycle. I want to remind you, though, that while our PDSAs need to be data-driven, they need to be the product of an intentional process, and they need to be completed throughout your fiscal year. Also sending in documentation either by both a team charter and a summary storyboard. Those are those hard and fast requirements that have to exist in all of your PDSA cycles. But even with meeting those criteria, PDSAs do not have to be complicated, they don't have to be long, and they do not have to be boring. So like I mentioned earlier, whether or not you've completed all of your LAA-specific or even Learning Collaborative-specific PDSA cycles for the year, or you're just kind of starting to think about next year's planning and getting ready to brainstorm, we have some tips for you that we think will be helpful in either wrapping up this year's work or getting a jump start on next year's work. And it's a really easy thing to think about. We invite you to consider a meaningful, simple, and short PDSA cycle. So let's break those out. When I talk about meaningful, I'm really encouraging you all to connect to passions, or even if your team has a couple of those sort of pebbles in the road, think about the frustrations that are in front of your team. Within the consideration of meaningful, simple, and short, of course I'm going to invite you to use all of the steps that we've given you in the plan stage, things like looking at your data, things like creating your problem statements, your if-then statements. But really, this is at the heart of when your team is getting ready to decide what to even do a PDSA cycle on. Sometimes the easiest way to find your momentum is to find the things that your team really, really cares about. Find those passion projects that staff feel particularly connected to. I heard the great suggestion earlier when the question was, in this case, more about connecting QI work with parents and incorporating them. I heard someone mention, I believe it was our Oakland NFP team, that they first went to parents who they thought would be most interested. I encourage you to kind of do a similar activity within your own QI planning. If you have a team member who feels really passionate about breastfeeding or well child checks or doing developmental screenings, ask them how they might incorporate a simple short QI cycle into that. Those particular passion projects happen, I think, to instill a little bit more excitement from your staff in quality improvement and give them a chance to see quality improvement really as an exciting tool that can help move some of their favorite pieces of their work forward. On the other hand, if there's anything that just feels like it's lingering and is a thorn in your side or a pebble in your shoe, I encourage you to make a meaningful PDSA cycle to try to remove that thorn or that pebble. So explore both the passions of your team or the frustrations of your team so that you can find something that is less cumbersome, less unnecessary, or irritating. So with that, I'd actually like to open up either in the chat box or feel free to unmute yourself. I'm wondering if teams out there can share a project or projects that felt particularly meaningful or were tackling something that was handling a frustration. Tell me a little bit about what you've done. I'm just going to take the silence as a moment to remind one of those things that we heard our teammates mention at the beginning of our webinar today is that there's an excitement and an eagerness to hear from one another. So whether it feels super exciting to you or not, we would love to hear more about what you've done in the past. The QI advisors, we have an inventory of all of your wonderful projects, but it's so much more powerful when we can hear them straight from you all. So would at least one team like to share either a passion project or a frustration project that you were able to kickstart within your PDSA cycle requirements?
Hi, this is Sue from Oakland NFP. And one of the kind of passion projects I think that I found very meaningful, it's really some testing we did with our coin with IPV. But we received these cards called Consent Is cards from our local IPV organization in the county. And it was very, those cards were super meaningful because as we're talking to clients about like healthy relationships and what they look like, some of our clients had no understanding of what it means to consent to be in a relationship and what that means, that consent is ongoing. It's not like because you agreed to have sex with somebody last week, it means every time you see them, you still have sex with them, or what that relationship looks like. So for me, I found it very meaningful because it really opened the door for some really good conversations with our young ladies about what consent means. And a lot of times this was the first time they even knew they had option to do this in their lives.
Thank you so much for sharing that example, Sue. I think it's a really great exemplification of something that is timely and important, and it sounds like it felt like it was just the right time to do something on that project. Thank you. What other projects of passion or frustration has your team tested out? Okay, so put a pin in this idea, friends. If you're having trouble finding the motivation and the energy to move forward with any additional PDSA cycles for the year, remember, find the thing that feels close to your heart or find the thing that will help relieve an inefficiency or a frustration that you have. Moving on, let's take a peek at the idea of keeping it simple. We heard a really great hint from one of our coin teams here. They heard that through their coin advising that you don't have to have every single member of your team test something out. This is a great way to be thinking about how do you do something in a simple way. How do you do something that feels, we use that adage of low-hanging fruit. What's something that feels simple or obvious that would help you test the improvement of a process? And when we're thinking about simplicity, I invite you to answer this question. Are there any common everyday problems that could make work easier and improve outcomes? I'm thinking about some of the conversations that we've been having across all of our models lately of how could we possibly use quality improvement as a way to improve our data quality? Could this be a way that we infuse two pieces of our funding requirements to kind of find a better space? Things like trying a simple PDSA to try out a new checklist, maybe having just one home visitor use a tweaked appointment reminder process, things like that. It doesn't have to be super duper complicated. It doesn't have to be something that everyone tests out. It just has to be something that is nice, neat, and tight in terms of following the PDSA process so that you can learn something from it at the end. So it looks like I'm going to take just a moment to possibly go back to our last one, but I saw some really great comments from other team members that I'd like to share. I'm scrolling back up. So Jackie from Calhoun PAT mentioned that they haven't necessarily done a PDSA on this particular idea, but they do a lot of little pilots throughout the year in addition to their PDSA cycles. They have a team a bit larger than some of our other teams, a team of about 15, so there are a lot of passions within this particular group. Most recently, they've added more play groups to try out, more STEAM groups, a brand new multi-generational play group, and more. That is super exciting, Jackie. Thank you for sharing some of those ideas of content that your team is focusing on. What I really like, what you mentioned, Jackie, in addition to some of the topics that your team has played around with in terms of play groups, I love that you mentioned small PDSA cycles. Gone are the days, my friends, of 6 months, 9 months, 12-month PDSA cycles. We are asking to really scale down and think of something that really fits the scale of the energies that you have. We're going to talk about keeping PDSA cycles short in just a minute, but keep that idea close to mind that Jackie mentioned of thinking about small PDSA cycles instead of large events. Hearing from our friends at Hurley NFP, Trina mentioned that she's reviewed the performance measure reports and allowed the team to choose what they felt was most important to them. Oh, that's so beautiful, Trina. That really hits into finding the passions of their team and being able to use this modality of quality improvement as a way to really further your own interests in the work that you all do. You are all the experts of your day-to-day processes and the big picture of what your teams are aiming for. So you are the best to be able to really pick a target and pick a problem that you're aiming to improve. Thank you for sharing that. Trina also mentioned that the team sometimes can feel overwhelmed by the amount of time that they spend on planning. That is so incredibly true. I think that we've mentioned this before, but somewhere between 75 and 80% sometimes of the entire time and energy dedicated to a PDSA cycle can be front-loaded in the plan stage. That is absolutely right and something that can be overwhelming, Trina. I think that is really clever, that what Trina is saying is that she's asking her team to pick things that are meaningful to them. Trina mentioned she also lets the team lead. So she's able to share that baton with others so that people are sort of charting the course of their PDSA cycle. They're feeling the spread of leadership and decision making, and I think that there's a lot of power in that. The Hurley team decided that each staff would stay in their role for an entire year to become familiar with what needs to be done. So when you hear us talking in our QI trainings, or when you see on a QI team charter, you'll remember that there are roles within a PDSA cycle. Trina's team is letting team members stay within their role across different PDSA cycles for an entire year so that they can really sink into those particular roles, get fluent and familiar with them before they move on. It sounds like Hurley has also explored different ways to get their clients involved in CQI, finding someone who would be committed. The team discussed maybe changing the title of CQI and making it something that's more relatable to their clients. I love these ideas, Trina, and I love that you're thinking in innovative ways to not only make QI more interesting, but also maybe a little bit more accessible to not only your staff who are working on QI, but also the families that we're asking for increased engagement from. We can't wait to hear some of the other things that our Hurley friends have come up with. So Trina, keep us posted on how your data quality work is going, and how your structures of your team structure, and how you're even calling QI, or what you're calling QI. Let us know how that goes. We'll be really excited to hear. So in terms of, let's move back to this slide of keeping it simple. So when you're getting ready to plan your last PDSA cycle or cycles for the year, or ready to kickstart for next year, we encourage you to think about simplicity. Teresa from one of our PAT teams mentioned that their PAT home visiting program works very limited hours and has limited hours in July and August, and has some difficulty getting reconnected with some families to complete visits in September. The QI project that this team is working on is sending a postcard mentioning that the program is thinking about you in July and August, and they're hoping to see better connections. Teresa, thank you so much for sharing that idea. I think this is a wonderful way to keep that bridge going and connecting families, especially during those time periods in which they tend to have some more space from your program. I love that you've added something that really doesn't necessarily have to be really expensive, really time-consuming, or incredibly complicated. This is kind of a one-stop shop of letting families know that you're still thinking about them. Hearing from Maureen at Ottawa Area PAT, I'm hearing that this team was frustrated that their initial child health records were at 22%. The staff was positive that they were doing them, and they couldn't figure out why the visit tracker wasn't showing their work. So out of that frustration, they chose this particular topic for their QI project. And what this team found out is that they were entering their data, but they were entering it in she mentions wrong place. I would say a different place than maybe where we're pulling for our analysis. And this team has gone ahead and turned this around. They've gone from 22% of having their initial child health records to 100%. So Maureen, thank you so much for sharing that. I think that you've actually hit upon a couple of things. That first slide of finding something that is sort of the frustration, the thorn, or maybe the confusion. So really making it a product of meaning, something that's meaningful, but it's also fairly simple. Are we putting this data in the correct spot? Let's find out where it needs to go. Let's see if that's where we're putting it. And let's try out everyone putting it in this one designated spot. So here, right there, you've hit upon finding meaning in your PDSA cycle and finding simplicity of a cycle. I think that's a terrific example of both of them. And Maureen mentioned that on a side note, they created a new checklist to help with their paperwork and data entry. So there's that simplicity that maybe it was as simple as making sure that staff had something to lean on so that they could check the boxes when they're entering their data. And it sounds like that was a really, really successful tool. And Maureen, I don't know if you're seeing the chat box, but your friends across the state would love to see your checklist. It sounds like others are really finding that helpful. Our friend Kara mentions that they actually had a similar situation with their screenings. They were showing a 30% completion, and they felt really sure that their screenings were actually being completed. With some investigation, they found out that they were entering data in a different place than your friends over here at MHVI are pulling it for analysis. And they then were able to move that needle up to 100% of their screenings being completed. So kudos, teams. And thank you for sharing those real life examples of finding something that, whether it be a positive passion point or maybe an area of frustration, finding simple ways to leverage those feelings so that you have an engaged team who's ready to conduct a test for improvement. Wonderful examples, my friends. Thank you so much. So lastly, keeping it short, we really want to encourage you all to think about your PDSA cycles not as marathons, but as sprints instead. We've heard a couple of teams mention this idea of, instead of one giant complicated PDSA cycle, maybe breaking it out into shorter, sweeter cycles. So one of the things that I want you to be thinking about is be mindful of your timing, be mindful of your energies. We'd encourage you to think about cycles that last somewhere between 2 and 8 weeks. Now, that's not a hard and fast rule. That's going to depend a lot on the particular change that you're looking for and how your data are going to be available to you. But the point is really that this doesn't have to be something that lasts quarters or years. It in fact should not be. Those longer cycles tend to be very energy draining for sometimes what we notice as QI advisors is the same impact as a shorter cycle. In fact, if you can keep your teams engaged with shorter cycles, you oftentimes are able to run through more in a fiscal year, and there's less energy being drained. So we think that there's a lot to be said for running shorter cycles. Make sure that the problem that you're tackling fits within that idea of a short cycle. This might not be the time if you only see 3 pregnant women in a quarter. This might not be a short cycle to find out how to increase initiation of breastfeeding. Rather, maybe this could be focused on something that you do every day, something like visiting families or sending reminders, completing certain screenings that are done on a very regular basis. Just make sure that your data points can align with that shorter segment of time. For instance, and here's my example, a 4-week PDSA cycle might not be appropriate for a process that only happens every few months. So if you're testing out an improved process related to new staff orientation, if you're only bringing on staff a couple times a year, that might not be appropriate for a short scale PDSA cycle. But if there's something that you do very frequently throughout a time period, so things like sending out reminders for upcoming home visits, that might be something that is amenable to a short cycle. So friends, I'd love to hear you all tell me and our other friends on the call, what are some short cycles that you've tried out in your time of practicing PDSA? So I'll invite you all. I'm not hearing anything or seeing anything in the chat box at this point, but I'll encourage you and invite you to put sort of a pin in these ideas so that you can be sharing in upcoming community of learning calls or with teams that you're close to, or maybe even in one of our grantee meetings coming up. I'm hearing teams find interest and excitement in hearing about all of your PDSA cycles. So if any of them fit within any of these categories that we're suggesting you use as sort of a jump start to your next PDSA cycle, feel free to share them with me and I can triage them out to the rest of our teams, or put a pin in those ideas and bring them to some of our next community of learning calls or our in-person grantee meetings. So with these concepts of finding a PDSA cycle that is meaningful, that is simple and is short, I invite you to get going. We have about 10 weeks left in this fiscal year to address any lingering CQI project requirements that your team is accountable for. So as a team, check into how many of your required PDSA cycles have been completed and get going on those that might still be lingering. Don't forget that your QI advisor is here. And not only are we here to help, but we would like to see your team charter before you make it to the due stage. This is really helpful, especially for teams that who might be getting their feet wet for the first time on a short cycle. We'd love to see your team charter before you get started, just so that we can make sure that you have a solid data plan and that everything is ready to go. So send us your team charter, even if it's just a draft. Your QI advisor would like to take a peek and give you any advice as you get started and are ready to move forward. Make sure that you build in time in these next 10 weeks to complete your PDSA storyboard summary. So you know that across the years, we've given you a lot of freedom in what your PDSA cycle storyboard summary looks like. Just make sure that you have enough time to get your summary completed and sent over to your QI advisor before the fiscal year is over. And be sure, as always, to connect with your QI advisor if you need any help jump-starting and completing your final projects for this fiscal year. We are here to help you. We have a lot of ideas of things that you can do in short, sweet, simple, and meaningful ways so that you can also be checking the boxes of your CQI requirements. Don't feel like you're on your own with that team. We're here to help you. With that, let's see. I'll ask if there's any lingering questions when it comes to kickstarting a short, simple, and meaningful PDSA cycle. Okay, teams, thank you so much. And now I'm going to pass the mic back over to Brenda.
So we have some reminders and final questions, and I want to circle back to something that Robin put in the chat box. For everyone who has volunteered to share tools or checklists or what have you today, the simplest method right now is to attach those and reply all to the Community of Learning email that went out to everyone about this particular webinar so that everyone can get the tools. So just a quick reminder for the quality efforts. For the QI Learning Collaborative, you're participating in one Learning Collaborative. You're completing 2 PDSA cycles. Everyone has pretty much finished up their first one, but just as a quick reminder, make sure you send in your storyboard for that. You're submitting data via REDCap monthly and updating your team charter every month via the QI mailbox. We encourage you strongly to review those QI Learning Collaborative update reports that are shared out with the collaborative and look at what other teams are doing. This is a great spot to see where someone else might be testing a tool or something that you would be interested in as well. And we always encourage you to reach out directly to those teams, or if you're not certain how to get in touch with them, let us know and we can connect you. For the quality planning teams, our 32P friends who are in the quality planning, you've been working on developing that action plan with MHVI, you're participating in calls, and on-site support, I hear has been, kind of scheduled or looking for other methods to connect for what is best for you. For the LAA-specific improvement efforts, you're under that requirement for 2 PDSA cycles. Maintain, complete, and share your required documentation. That would be the team charter and storyboard. And we ask that you connect with the advisor at least quarterly. So this week, the 15th, was the check-in for this quarter. If you haven't sent someone something in, feel free to do so. And remember with the LAA1 set, you also have a storyboard as part of those requirements as well. So make sure that you're sending those in too. Additional reminders, we have the next grantee meeting coming up in September at the Crown Plaza in Grand Rapids, and you'll see registration coming out from MPHI soon. Our next Community of Learning webinar will be in October, so after that last grantee meeting, it is at the same time, 9:30 to 11:30. A reminder here, we also have the Home Visiting Conference that is open statewide to all home visiting programs. That's August 6th through 8th. In Kalamazoo, and there are going to be a couple QI sessions there at the Home Visiting Conference. I don't know if, Robin, you want to speak to what they will be?
Sure. So on the first day of the conference, which is August 7th, so the first day is the 6th, that's Model Day, but the first day of the actual conference content on the 7th, there will be a session on quality improvement tools. It's called Tools, and More Tools. And we're excited to be able to share some more non-traditional QI tools that you have maybe not heard a lot about to expand your toolboxes so that you can learn something new to use within your quality improvement efforts. So invite you to check that one out and come and join us if you're able. And then on the second day, the 8th, we have another session that is really kind of looking at developing a culture of quality within your program, but really from the leader's perspective. So how can you nurture and foster a culture of quality in your home visiting program, or even within the agency and organization where you're situated? What are some things that you can do as a leader? So we invite you to join us for those sessions if you're able to, and we look forward to seeing you there.
Thanks, Robin. Are there any final questions?
Brenda, I don't have a final question, but this is Robin again, and something that I wanted to share that I kind of briefly shared in the chat box, but want to give everybody a heads up on because we didn't formally say anything about it today, is that we are really, really close to sending out information regarding our new shared space for all of our work together. This space is going to be hosted on a platform that's called Group Sites, but you will get more information about it soon. And one of the neat things that comes with this space that hasn't come with some of our other shared spaces that we've had in the past is that everybody will have the ability to create a user login. And that user login is going to allow you to be much more interactive in this space. You can share and upload documents with each other. You can start discussions and ask each other questions about your quality efforts that you have going on, or share really neat things you've learned along the way. You can share your materials from your quality efforts, your planning documents, your team charters, your storyboards, so on and so forth. So we're really excited about this. As we kind of release it and learn more about how you all are using it and what you'd like to see more of, we really will invite you to share your feedback and thoughts with us so that we can really make this shared space as useful and as meaningful to you as possible. So be on the lookout for more information to come here very soon about that.
Thanks, Robin.
Thank you, Brenda.
Are there any other questions before we wrap up our time together this morning? If not, we just want to say a big thank you. Again, I think that Skype worked out well. There were lots of questions in the chat box. We know that no kind of webinar conferencing source that we've used so far has been perfect, but I feel like we had some great conversations going today in the chat box. We thank you all for participating. If you have any questions about your QI projects or your quality planning, please reach out to your advisors. And thank you so much, and go forth and enjoy your summer day.
Thank you, Brenda.
Thanks, everybody. Have a great day.